The latest global estimates by the World Health Organization show that tuberculosis remains the second leading cause of death worldwide following COVID-19. Now, despite being a curable disease, as you've heard in that clip, TB claimed the lives of 1.3 million individuals globally in 2022. This year's global commemoration aims to draw attention to the urgent need to strengthen collective efforts to put an end to the suffering and the deaths caused by TB. Now, let's discuss this. We are now joined by Bada Pharasi, the CEO of the Innovative Pharmaceutical Association of South Africa. Thank you so much, sir, for your time this afternoon. So let's talk about what is driving the TB epidemic in South Africa, especially as you hear that South Africa is one of those hotspots globally for TB.
Good afternoon, Unati, and good afternoon to your viewers. As we have heard from the previous clips, South Africa is not doing so well in terms of reaching the goals of reducing deaths and people infected with TB by 2030. Just as an example, although the intention had been to have deaths from TB reduced by 20% in 2020, South Africa only managed 17%. And as we've already heard, about 54,000 people died in 2023. So this is really something that causes people to panic. And it is not surprising that we had a march by TB activists who are concerned that government is not doing enough. We need to put more resources into combating the epidemic.
And I mean, when we start talking about, the burdens of TB on South Africa, and especially when we begin to focus on the difficulty of MDR TB, I mean, is this also one of the reasons that we are among the global hotspots, do you think?
Yes, for quite a long time, South Africa has been one of the three leading countries in terms of TB infection and deaths, the other countries being India and China. There was a time some years ago when South Africa seemed to be doing well, when we seemed to be almost at the point of getting rid of the epidemic. But we have regressed a bit in recent years. So it is serious enough for everybody to be concerned.
I mean, one of the points that you are making is, of course, that not enough effort is being made, from government. I mean, when we start looking at, treatment as well as, diagnosis, fewer people were diagnosed and started on treatment with only 175,650 on record in 2022 globally. In the case of South Africa, I mean, what do you think the reason why people are firstly not being diagnosed, and when they are on treatment are not taking their treatment or not completing the course?
Well, for one thing, we know that there is unfortunately a stigma surrounding TB infection. And so you find that people have some reluctance to go forward and get tested and to be treated. The other factor is that TB has been having the kind of treatment regimen that has taken up to 18 months, up to even 2 years. But this has now been reduced to about 6 months. And the fact that people tend to stop taking their treatment has to do with the number of dosages that they have to take per day and the very long treatment regimen. But these days we have drugs that allow patients to take a fixed dose combination that allows them to take the drug only once or twice a day. And treatment has been shortened from the 18 months, 2 years to about 6 months. But when it's very, very complicated, such as MDR TB, then treatment can go up to 9 years. Sorry, up to 9 months. But it's been reduced, so it should be easier for people to comply and take their treatment.
But it seems that it's not, and I hear you when you say significantly reducing, the time frame. People battle just taking everyday vitamins, as an example, or some, chronic medication that is essential. So when you look at these parallel processes that are currently ongoing in terms of trying to destigmatize, TB, but also at the same time encouraging those that are on treatment to take treatment, you speak of also collaborative efforts that are needed to be done. So how then do we begin to even answer, the theme around, yes, we can beat TB, by looking at those two issues, particularly in terms of, getting rid of the stigma, but also encouraging people to take their medication?
You mentioned collaboration. That is very, very important. The first point that one would want to make is that there has to be a high-level political commitment. Then you need multi-sectoral collaboration. We have to realize that combating TB is not something that should be left to government or the health department alone. There has to be collaboration across relevant ministries and departments, such as health, finance, education, those responsible for food and social welfare, justice, labor, even transport and migration. So there has to be collaboration with patients, affected communities, and civil society. Government does have to collaborate with the private sector. And then, of course, with national and international supporters and partners. Importantly, we have to look at best cases from other countries that have done a lot of research in innovation to ensure that we have better diagnostics and better treatment for TB.
I acknowledge, of course, that a lot has been done in terms of progress, even introducing, technology into the fray to try and, speed up the process and end TB, essentially. You reckon, we still have a long way to go?
I think so. We have to intensify our efforts into research and innovation. We have to intensify research from the development of new tools to their adoption and effective rollout in our country. We need to invest in the efforts that we already have undertaken as healthcare workers to ensure that more people enroll and more people are tested. And that's very, very important. And, there's been a call for an urgent boost in research investments so that new tools are developed and made rapidly available and widely accessible in the next decade. The pharmaceutical industry constantly looks at new ways of treatment that will reduce the number of doses people have to take per day and reduce time to ensure that more people can take their medication and do so in a reduced time span. As time goes on, one would hope that we can even reduce the time for treatment from 6 months to even less than that. And that can only be done with more research and development.